Hello, my name is Dr. Kate Goldberg. I'm a consultant paediatrician, which is a specialist children's doctor at Blackpool Teaching Hospitals. I really wanted to talk to you about how you access services if you're worried that your child is ill or has hurt themselves. The doctors and nurses based at this hospital are worried that parents and carers in the current situation don't know how to access services if they're worried about their child. The most important thing I want to say is that most of the services that you usually depend on are still available, even though it might feel different at the moment and accessing them might be different to usual. That includes services for babies, children and young people. There are services available at the pharmacies, at all of the GP practices and at the hospital. We know that many of you are worried about how to get to our services. It's also important to us that you know that the hospital is a safe place to bring your child if you're worried. It's really important that you recognise, like us, that children can become sick really quickly. And we also know at the moment that there can be delays in accessing either a GP telephone appointment or NHS 111. The poster that accompanies this describes some of the things that might indicate that your child is ill. Problems like a high temperature, breathing difficulties or a rash that doesn't go away. We want you to know that if you haven't been able to access help for these problems within 4 hours and you're still worried about your child, that you don't hesitate to bring your child to A&E. The A&E doctors and nurses are available to see children. And the doctors and nurses on the children's ward here at the hospital are also still available to see your child, to look after them, and hopefully to be able to send them home if they do not need to stay in hospital. All of this information is available on the accompanying poster that has been produced by paediatricians in the UK.